So just to start off with a little bit about me. So I am the Head of Access, Participation and Outcomes. I'm not really going to go into that too much detail because it's not really why I'm here, but my current job is to try and increase access and success and awarding of all groups that come into higher education in my institution at Leeds Trinity University. I've only just started it in March, so don't ask me about the detail because I'm still working that out. But I'm here to talk to you a little bit about experience. And it was really nice actually to hear Kama talk about trauma-informed practice in the courtroom, and hopefully why that is will unfold as I go through this presentation. But it's really important to think about people and human beings through that lens when they're coming through the criminal justice system. So straight away I'm going to get right over to you. So there's a wonderful book by someone called Bessel van der Kolk, and he's an expert in childhood trauma and adverse childhood experiences and a therapist, a psychiatrist actually. And one of the statements in a book called The Body Keeps the Score, which is a fantastic book, if you ever wanted to be interested in trauma or adversity, the reason why I say it's a good book is you don't need to read it from the front to the back. You can pick it up in any chapter, and he talks about case studies. So it's a really easy read, but it's really, really good. Gets complex issues and transfers them into accessible information. So the parent-child connection is the most powerful mental health intervention known to mankind. That is a quote within the book that I thought was quite powerful. Can anybody tell me what on earth he's talking about when he says that statement? The most powerful, the parent-child connection is the most powerful mental health intervention known to mankind. What might he have been getting at? There isn't a straightforward answer, so don't worry about getting it wrong. What might he have been thinking when he said that statement? The most powerful mental health intervention known to mankind. I appreciate you're not all social workers or clinicians, right? So don't worry too much about getting it wrong. But what might you think he might have been getting at? Go on, your hand was about to go up.
It's really simplistic. I suppose that the relationship between parents and children is pretty important for mental health.
Yeah. So if you don't get it right at those, they call it in neurological terms and child development, the first 3,000 days. So from conception to 2, critical for neural development, for the way babies develop biologically, chronologically, etc. It is absolutely essential for people to develop well in those earlier stages. I'll give you an example. So a couple of years ago, I've got a daughter, she's 7. She's just about to turn 8 actually, this month. And before she was born and I was at work, people would have babies and they'd be talking about, oh, we've had a baby and I bought this little towel for her, and I'd be thinking, shut up and get on with some work. And then I have my baby and all of a sudden I'm like, look at her little pinky, oh, isn't she cute? And what happens there is we're biologically programmed for what they call a serve and return interaction between parent and child. So we just do it. Even the person that's not really necessarily got parental bone in their body, give them a baby and they'll go, hey, go. And it's because that's really essential for us as parents, as adults, to get that connection with children. And sometimes, as has been mentioned already, it can be fractured. Okay, so in terms of my lived experience then, I've not always been in the position that I'm in today. So my mum, I'm from Leeds actually, I don't get to speak in Leeds a lot, so it's really good for me to be here today. So my mum was born my mum was in a children's home when I was born in 2001. You're nodding, I had you, didn't I? I wasn't born in 2001, I'd had an hard life if I was born in 2001. I was born in 1981, and my mum was in a children's home. She was 16 years old when she fell pregnant with me. So go back to that powerful interaction and connection between parent and child. Now, as has already been pointed out, I have worked in the youth justice system for 15 years, so I've worked now with a lot of 16-year-old girls that have been in the care system, boys too, but particularly girls. And so although I can't remember, I can imagine, and through conversations that I've had with other people that were aware or around, and conversations I've had with my mum obviously was, well, not obviously, my mum was sexually abused, went into the care system. For those that don't know, the legislation for care leavers, which means that when you leave care, you get access to resources and support, was only come about in 2000. So mum at that time would have been, okay, you've got a kid, there's a flat, off you go down to the job centre, okay? So my mum's circumstances were pretty strained at that time. Before she reached the age of 25, she went on to have another 4 children, so that meant she had 5 before the ages of 25. Now, I've just told you I have a daughter who's 7, nearly 8. She came along when I was 35. I've got a wife who's full-time employed. I'm full-time employed, and parenting is bloody difficult. Those that have got kids in the room will be nodding away. Yeah, that's difficult. So to parent 5, and I'd never seen my dad, and the other kids' dads never stayed around either because men were taking advantage of mum's circumstances. So it's 5 kids with no guy to help and support and do that parenting process. So I'm going to quickly do some more interaction. When we talked a little bit earlier, Cameron talked a little bit about adverse childhood experiences and trauma. I'm not going to really get into trauma because it's quite it's defined, but people experience trauma in very different ways. What's traumatic to you might not be traumatic to me, might be traumatic to you, but not traumatic to you, right? So I'm going to stay away from trauma, but I'm going to talk to you about the things that we know through science that underpin the manifestations of trauma and what we call adverse childhood experiences. And I'm going to do it in a really simplistic way because we all understand. Put your hand up if you've ever been stressed. I'm clocking for the hand that's not up in the room actually here. Right, so let me ask you a question. Is stress bad for you? Yeah, I've got some nods. Have a little think about it. Is stress bad for us? Yeah? Okay. Well, for those that were nodding, I'm going to push back a little bit against that, right? So the science suggests, so this is toxic stress. This is work, all the references that I talk about will be on the back end of the slide, by the way. But so Jack Shonkoff, we know, I'm not going to bore you with adverse childhood experiences, but what we know through the research is that the more a child has experienced what they call adverse childhood experiences, that's sexual abuse, emotional abuse, neglect, parental separation, parental incarceration, etc., the more likely, it's not causal, but the more likely the likelihood of poor health and social outcomes, more likely to be incarcerated, more likely to be addicted to drugs, more likely to have teenage pregnancy, etc., etc. But what Jack Shonkoff wanted to do from the centre of the developing child was look at what are the kind of driving factors behind that. So they drew on the science. And what the science, and I thought this is a really good example, what the science shows, that actually stress isn't innately bad for us. I'll give you an example. Imagine you're never ever exposed to any stressors, right, up till you're 11, and then they send you off to high school. Yeah, you're gonna have a breakdown. Do you remember how tough high school is? Bullying, you know, politics, all that kind of stuff. So stress is good for developing, but only when it's a mild elevation of the stress system. So can anybody give me an event that you might be going through that might just slightly elevate the stress system that might be positive for building resilience? Anything? Presenting in public. Thank you very much. Look at me and you. Yeah. When I'm about to get up here, my anxiety's raised. Of course, it's public speaking. It's not particularly easy, right? So that's a really good one. Thank you for that. Any more? Something that increases your stress levels slightly. Yep. Doing a law degree. You doing a law degree? Yeah. Yep. Driving. Yeah. When you're beeping and screaming at people. I know you're giving yourself away there. Yeah. Starting a new job, brilliant, yeah. Deadlines, yeah, for studies and workload, yeah. Any, was you going to say one? Exercise, yeah. All of these things reduce, slightly get the increase, the elevation of the cortisol, etc. in your body. So yes. But they develop your resilience, because when you go for your first interview and then your second, in fact, that's probably a bad example. Interviews are always hard, aren't they? But things that can help you next time round when you're dealing with that, it's good for your building resilience as it goes. Then you get tolerable, and I'm just conscious of time, so we'll flick through this. Tolerable, serious temporary stress response system buffered by supportive relationships. Now, as the theory goes, it's not necessarily the event in and of itself that makes it toxic, which is the third stage, because if you've got supportive relationships around you, and this is where I love this research, because it starts to talk about connections, attachments and relationships. If you've got that support, and I'm going to talk to you about my book, we call this relational poverty. People understand economic poverty. If you go to people and you say, what does it mean to be living in economic poverty? They'll say, you ain't got no money. And if people have got a wealth, they'll say, well, people have got loads of money. But it's true with relational interactions for children as well. Parent-child connection, most powerful intervention known to mankind. Relational poverty is a lot of the children that you'll be experiencing, like me. I'm going to tell you a little bit more about my story in a minute. When you come through the system, not having those attuned, nurturing, caring, consistent relationships around you as a child is significantly damaging. So I like to see things through relational poverty and relational wealth. And then obviously then the prolonged activation of the stress response system in the absence of protective relationships. So children are more likely to recover from toxic events that happen to them if they've got attuned, connected relationships around them. You with me? Yeah? Okay. So unfortunately for me, from my experiences of not having that attuned, connected, persistent and consistent relationship around me, I entered the care system as a result of my siblings being abused and neglect. Went into the care system at the age of 7. That manifested, and this is where I'm going to skip through it because of time, because you want to get on with your break. That manifested into me being having 18 different places to live by the time I was 13 years old, in the care system and out of the care system. It meant that my education was pretty much non-existent. I then got excluded from school when I was going for a period of time at the age of 15. I mentioned child criminal exploitation earlier. Because I'm quite savvy, I might not have been academically intelligent, but I was quite savvy at that age. Adults seen that I was unsupervised, mum wasn't really looking after me, and by the time I was 17, I was heavily addicted to heroin and arrived through the court system, went to Brinsford Young Offenders Institution at 17 and went through a spiral of prison and heroin addiction between the ages of 17 to 23. So it's a bit of a dark story, and I have skimmed over that, and I do apologise, but you want to go for your break, right? Okay. But although it's a dark story, in 2007, I was sweeping. I got myself a job. I usually did that when I got out of jail because I never see myself as a offender or criminal, whichever you want to frame that. I'd get out of jail and I'd go and get a job. But because I had these unresolved childhood issues, I always gravitated towards substances to help mitigate those experiences. Well, the best way to explain it is I needed a hug. I needed somebody to just tell me, don't worry about it. It's okay. Your future's going to be okay, we're going to have it right. But I didn't really have that. My mum loved me, I've still got a relationship with her now. She did the best she could with the circumstances that she's given. I don't carry any animosity towards mum, dad, or anybody that was around in the abuse, because if I take that with me, who does that negatively affect? Yeah, and I'm just not allowing it to happen. So, sweeping the floor in a warehouse in Leeds, just down the road in Sturton, and I heard over the radio that Leeds Youth Justice Service wanted volunteers. I didn't know nothing about no risk assessments or DBS checks. I rang them up and I said, listen, I think I'd be good at working with kids in my own city. Is there any chance I could have a go? Fortunate for me, I came across somebody who was willing to give me a chance. I've worked in the youth justice system for 15 years. I've wrote 3 books, as you can see up there. And I'm doing a bloody PhD. So studying, but not quite law, but it's a criminology PhD. So I wanted to kind of arrive on that because I've skipped over it, and like I say, I do apologise. But when we think about why that research is really important, because if we know it's the absence of attuned, connected, emotionally available adults in children's lives that can help them develop well, what does that mean for us? What does it mean for us? People that come into contact with these, and I don't care whether you work in the court system, youth justice, probation, police, I'm not interested. What does it mean for us that come into contact with those children? Come on, be brave. It's really simple. Yes? Every intervention, every interaction is an intervention. It doesn't matter how small it is. If you come into contact with that person and you can develop a relationship with that person as they're going through what I would argue, and one of the things that hasn't been touched on today, is the process of social marginalisation and inequality and social exclusion, because that is a bedrock of the criminal justice system. Believe me when I say that to you. So we might turn up, and I've done youth justice system for 15 years, we might turn up thinking we want the best for people and we are really good and we're really honest and we're putting 50 hours a week, sometimes 60 hours a week into our work. But trust me, from the perspective of people that come into the system, it's not just, it's not fair, it's not equal. So when the previous speaker was up, I forget her name, sorry, was talking about victims or witnesses, and that's the way the criminal justice system works. Trust me, I know it intimately. But when I racked up to the court and I was a 17-year-old boy addicted to heroin, yes, I was a perpetrator. I got done for selling heroin because I was groomed by adults. But was I a victim as well? I'm telling you, I was a victim. We used words like proportionality and dosage when we convict someone. And rightly so, I was convicted of selling drugs because I was selling drugs. But sometimes those words can be quite binary. It's true, you can be two things in the same space. I was a perpetrator, I was a criminal, I was an offender, but I was also a victim throughout my entire life, actually, from birth. So, I'm really quickly going to flick through this, but it goes into more detail in my book. So when we talk about trauma-informed practice, if you look at the definition from SAMHSA, I can never remember the acronym, Substance Abuse Mental Health Administration Services. Well done, yeah, well done. SAMHSA define it as safety, trustworthy, choice, collaboration, empowerment and cultural consideration. That's the one that interests me because I don't think we're very culturally considerate with people that come into the criminal justice system. She mentioned the chair being thrown around, didn't she? I think sometimes that's because you're so triggered by the system, just lose control, dysregulate. That's a trauma response. So when we talk about trust, I don't believe we should ever assume because we're good, because we're kind, because we work bloody hard, and most of us do work bloody hard, and the system will, you know, kind of take a lot from you. But you should never assume that you can gain trust from someone that's experienced social marginalisation, social exclusion, and a kind of victim of inequality. So through my practice, I wanted to share how I've manifested a practice model of obtaining that trust from my lived experience and my practice experience and my research. Because it's no good me saying, if you go out and get yourself done for a couple of twocks, get locked up a bit, you can go work with young people that get, yeah. Oh, 5 minutes, yeah, sorry. So I won't go into too much detail, but the presence, in terms of the principles for the model that I follow, presence is the ability to get a whole Gestalt in one picture. When I'm looking at that person and they're coming through the system, what do they see? Are they a black person that sees a white person when they've experienced inequality and social marginalisation and racism in this country? Because if that's what they see, I need to be aware of that. If they've been a care leaver, I've got my badge over there. If they see a care leaver and I've got my badge on and they look at my badge and they see just some jumped up social worker, I need to be aware of that. So presence is not reflective practice, it's thinking about the whole dynamic. What does the person see when they're looking at me? The attunement then is like tuning a radio station in. It's being able to, once I recognise that, how do I mitigate that through my relational experience? How do I address that? What are the things that I might ask questions? How might I work with that individual to be able to get them to believe that even though you see this, I can be something else for you, you know, right? And then the connection is just really quickly, in the youth justice system, they use the word engagement all the time. Engagement is a word that comes from privilege and power, authority. I'm saying something, you're not engaging. Now, what I've said in people in youth justice when we're dealing with traumatised children is do this. Change the word engagement to connection. So instead of someone coming into the office and saying, we're not that kid, I've knocked on the kid's door and they're not engaging, you switch it and you say, I've just knocked on that kid's door and we're not connecting. What's just happened just as I've changed that word? What's just happened? Yeah. Because relationships serve and return, they're reciprocal. You've got some responsibility about that engagement too, right? I work in higher education now, they use the word there, it kind of gets my goat a little bit, they're not engaging. Well, maybe your style's not engaging, how about that? All right, so presence, attunement, connection, if you follow those things, I promise you, you're not always entitled to it. You follow those key principles, you're more likely to develop trusting relationships in your practice. Now you're going to go get your break, but I want to say thank you for listening to me and have a good day.
The sort of general pattern of findings suggests somewhere 7% or higher of autistic criminal justice system people that go through the criminal justice system are autistic. But that can range right up to kind of in the 40% when you look at different cohorts of that. But importantly, autistic people are much more likely to be a victim than a perpetrator of a crime.